I find that when you approach it like this, that the response is an understanding response, that the goodwill is there.
In some cases, people may share that they have an anxiety disorder and they're getting treatment. And in one particular case, the person said, most people were supportive. However, there were others that said, it's all in your head, you worry too much, you can get over it, etc. They really minimize the challenge of an anxiety disorder. How should a person handle that?
Yeah, that's difficult. And those of us who work in the field come up against that time and again. People misunderstand the concept of anxiety. It's a misconception, if I can put it that way. And of course, that's because anxiety is such a common experience. We all experience anxiety. We all have to deal with stress and stressful situations. And so the answer, the statement that you hear is, but surely we all experience anxiety. Why should you have to take medication for it? Why should you see a therapist? And I think a person in that situation needs to address that issue, the distinction between anxiety as a normal experience and anxiety as a mental disorder. And that's why it's so important as a patient, as a person suffering from anxiety, to become informed, that you've read up about it, that you know what you're talking about, that you're able to identify the diagnosis and show the person and identify the distinction, the differences between anxiety as a mental disorder and anxiety as a general stressful experience. And then talk about it. Talk about how common it is. Indicate and point out how important people, public figures, have suffered from anxiety and emotional problems and have talked about their treatment. Talk about your own treatment and your expectations and what you're learning to do and the outcome. And in this way, they become informed. Mostly, I find that when you approach it like this, that the response is an understanding response, that the goodwill is there, but the goodwill has not been apparent because of their misconceptions. And through educating your friends or your social acquaintances, it's an enormous positive step in terms of their understanding of what's going on.
If a person should have a friend who is suffering from an anxiety disorder, and they may be very difficult to deal with, but then the friend becomes, beginning to start drinking to deal with their anxiety, and then you become worried about the drinking. How can you help? How can you handle that?
I think the first thing is to decide, do they need urgent help? Do they need an intervention? Are they at risk? And in a situation like that, I would advise a person to get in touch with a crisis counselor. You could do that through a crisis line, explain the situation to the crisis counselor, and then be advised by their recommendations, what you should do. Leaving that aside, if that's not the case, that the person is struggling but they don't need urgent help, they're not at risk, I think the next question is to decide whether or not they're willing to talk about their problems. Some people are, some people are not. If they're willing to talk about their problems, then you can offer to be a support, to be helpful, give advice, important to be non-judgmental. Now, it goes without saying that you need to know a little bit about mental health. So I would suggest become an informed friend. Know what you're talking about so that when you're talking to your friend, they can see you understand. And that's an enormous help to them. So you can be there to support them, to give advice, and in times give practical help. The more difficult issue is when your friend doesn't want to talk to you about the problem. And then what do you do? Well, once again, become informed. Get to know the issues that they're struggling with so that you can anticipate what may lie ahead of your friend, then be patient, be supportive, be of practical help, and wait for the day when perhaps they will be willing to talk to you. And that, if you're patient, that nearly always occurs. And so when the opportunity arises, you can be there for them, you can talk to them. Once again, because you're an informed person, they can see that you understand. And they're much more likely to listen to what you've got to say. If it's possible and it doesn't raise problems of confidentiality, talk to a close family friend or a close trusted friend and get their advice. Now, in doing this, it's important to make sure you look after yourself, establish boundaries, don't neglect your own social life, your family life, your job. The issue of enmeshment, that you get sucked into their problems, and this can have a detrimental effect on you. Always remember, in a situation like that, to maintain boundaries. There is you and your friend, and you have a responsibility to yourself, just as you have to your friend, probably more so to yourself. So it's important to maintain your own life as you're going through this experience.
Thanks, Dr. O'Sullivan. It's encouraging to know that if anxiety disorders are treated, they can even have an enriching effect on relationships. Thank you.
Thank you.